Hello there.
Hi.
Hi, Dr. Charan.
Hi, Dr. Vidya. How are you?
I'm doing very well. I hope you're doing well too. How's your evening
Yeah.
been?
Yes, yes. Hectic
Working day.
working
Yes.
day. Just came home and rushed into the washroom, sanitized everything, and then came.
You must be having a safety routine every time you come back from the hospital, right?
Yeah.
A
So I'm
whole
making sure I'm just
drill.
stepping out once and coming back at once. I'm doing everything in one go.
Oh, absolutely. I mean, you need to take care of yourself. Absolutely. I mean, when you're in the front line, you have to take care of every single thing. Extra cautious, in fact.
Yeah, I swear. So I want you to introduce yourself to the people who are watching us.
Sure. So I'm Dr. Vidya Nair. I am a holistic doctor and a psychologist. The reason I call myself a holistic doctor is because I did my MBBS. I finished my MBBS. I practiced for a couple of years. I pursued my interest in psychology on the fact that I noticed how a lot of things, I mean, even you understand as a doctor, are, a parts of our mind, our mental health and psychology of our mind is not incorporated in our healthcare, right? Like typical healthcare, when you look at it, you don't look at it from the aspect of mental illnesses. It's normally looked at from the aspect of just physical signs and symptoms and following a line of treatment according to that. That's when I realized, there's more to this that I need to look into because I also had a few experiences during my time. I was mostly in intensive care. I don't know, it's somehow the universe's way of telling me. I was always in intensive care. I've never been put into a ward where I've been doing just like normal ward work. Never. Always been in the ICU. Like critical care, ICU, neurosurgery patients. I've always been around critical patients. And during this time is when I realized, the power of the mind. And I mean, even you must have seen how,
Yeah,
patients have overcome illnesses just
yeah,
by their willpower and, having the support from their family, and that psychological support has really gotten so many patients out of bed. And I was like, this is something we need to incorporate in healthcare. And it's not just the physical signs and symptoms that we need to look into. And I've always been curious of the mind. So I was like, why not? Let's just go for this. And I did pursue my master's in psychology. And once I got into this, it was like I was like full-fledged into it after that. And I uh, followed various neuroscientists. I started doing my research in that. And there's so much more knowledge that I gained about a lot of things. And yes, and that's when I realized that, I want to be a doctor which looks at everything from every perspective rather than just the physical signs and symptoms, but also the psychology, the science behind it. And because, everything joins together somewhere.
yeah, yeah, yeah,
You can't look at it as just black and white. I mean, we are example of that. Human body is example of everything joining together
yeah,
somewhere, right? So that's how I started my whole journey through the ICU care and neurosurgery patients that I was along with. And yeah, so and then ever since I have been practicing therapist as a therapist, incorporating my education in my biology and the psychology as amalgamating that in my healing process for my clients. And yes, it's been beautiful.
yeah. I mean, what are the odds of doing MBBS and almost having not a career switch, but going to the other side of the spectrum.
Absolutely,
I
I
mean,
understand. I do get
yeah,
that question a lot, and I'm like, I
yeah,
know I understand, but then this is where my curiosity led me. And
yeah, yeah,
honestly speaking, so as children, when we are asked that I want to be a doctor, we just know like have this image of a doctor, right? And I'm like,
yeah,
yeah, I
yeah,
want to be that. And then when I finished MBBS and started working, I'm like, you know what? I want more. I mean, this is not exactly what I had in mind. I want like
yeah,
the whole sense of purpose was just drove me to this line. I think.
yeah. I mean,
Yes.
very few people follow their passion. Uh,
Yeah, I know.
that makes two of us. A
Yes, absolutely, absolutely. Yes,
lot of people told me like, if you're interested in brain, why not do neurology? Why are you doing psychiatry? I said because psychiatry has so much more scope and so much more to know.
absolutely. Oh
So
yeah, yeah, yeah.
yeah, I think the
Absolutely,
day, yeah, the day curiosity ends, I think we are done as doctors. Like, there's nothing more to know.
absolutely,
Yeah,
absolutely. I think we become dull when that curiosity just
yeah,
ends. I mean, that's what drives you, right? I think that's
yeah,
very needed.
yeah.
Yes,
So coming to today's topic, I know it's a super
absolutely.
interesting topic and I think very relevant topic, with or without COVID. But yeah, COVID made it all the more curious
Yes.
for people to know what are these anxiety coping strategies. So I don't want to discuss about anxiety as such. Like, I don't want to discuss about physical signs and symptoms and all of that, right?
Right.
But a little disclaimer for people: if you have anxiety disorder, you'll have to see a psychiatrist and a psychologist. These are
Right.
the coping strategies that we are going to help you with, in helping yourself without needing a psychiatrist and a psychologist. So,
Right.
when the only little difference between anxiety and anxiety disorder is if it impairs your entire functioning in terms of professional and personal, all the aspects of your life, then you'll have to definitely see, because we need to evaluate if it's secondary to a thyroid condition or a vitamin D deficiency, or is PCOS causing it, multiple areas. And then if it's daily anxiety that we all have, all of us are going through this, right? So Dr. Vijay is going to help us with what are some techniques. There are
Correct.
various grounding techniques, etc., that will be
Correct.
helpful, right? That's
Correct.
our
Absolutely.
agenda today.
Absolutely. That's
Yeah.
the agenda for the day. So yes,
So
absolutely, as you rightly mentioned,
yeah,
you know, anxiety disorder is something which we need to be diagnosed by someone, of
yeah,
course. But if you
yeah,
are dealing with anxiety and if you don't know also what to do here,
yeah,
what we're going to be discussing is going to help you there. Of
yeah,
course, that does not mean you shouldn't go to a professional. As
yeah,
you
yeah,
rightly mentioned, that you need to go seek help from a professional to
yeah,
see the deeper lying cause. It can be anything. It can be biological, psychological,
yeah,
deficiency, anything, right? So to understand that, you need a professional.
yeah.
So
For
the
example,
techniques, yes, go
yeah.
ahead.
Yeah, sorry. So, for example, when we look at anxiety disorders, they're as common as 18% to 25%. That's a lot. But
It
I
is.
feel all 100%, all of us go through anxiety in like various
Oh,
areas.
yes,
Yeah,
absolutely.
so this talk is going to help everybody. You don't have to be somebody with an anxiety disorder. It can be anyone.
Absolutely. Absolutely.
Yeah,
And
yeah,
it's, for example, just like, how we feel anxious just before an exam. It's like, oh my God,
yeah,
what if I not do well? How do I perform? Or before getting on stage, or even like coming on live. I mean, I have had this so many times. I'm like, oh my God, will I mess it up? Will I mumble something that I'm not supposed to say? I've felt the same thing. So everyone feels anxious. It's a very natural feeling. And I
yeah,
mean, the basic thing is it's actually a programmed mechanism in your body
yeah,
to deal with dangerous situations like like a calamity or an earthquake or something happens. We need to
yeah,
be able to be in action, and that's why this
yeah,
response is programmed in your body, right?
yeah,
But
yeah,
yes, if it becomes too severe, here we can do some techniques to get your mind back here,
yeah,
because when you feel anxious, your mind thinks that you're in some dangerous situation. That's when
mm,
this response is elicited, because it's programmed that way in your mind, right? That it is for some dangerous situation, like exam in your mind is a dangerous situation if I fail in the exam, right? So when I think about it now, your mind thinks that you are in some dangerous situation. So it elicits that response in your body. Your heart rate increases, you're sweating, you're trembling, you're shaking, and you even feel palpitations in your chest. Sometimes you have a dry mouth, right? All of these things. Now, what can you do to get your mind back to here? Because when you're thinking about these things, it's normally in the future or in the past, right? It's like
yeah,
somewhere else.
yeah,
You kind of dissociate from where you are. My mind's like gone away now to
yeah,
some space which is very scary, right? Thinking about those situations, and it can be anything. It can be a past experience. It can be an experience that you've been fearing for a very long time, always, right? So one of the basic techniques that you can use here is grounding technique. Now, a grounding technique, what does grounding mean? It means you're bringing your mind back to this moment here, grounding yourself to here where you are, this ground that you are at. Yes? And making you aware of this space and environment back, the place where you are safe and secure right now. So here a few techniques that you can use here are, so the first most efficient, and a lot of people use this technique, is called the 5 4 3 2 1, right? It's 5 4 3 2 1 technique. In that, you acknowledge or noticed or even call out loud if possible, or experience this possible. You acknowledge 5 things that you can see around you. So for example, if right now I'm doing this, I'm going to be like table, chair, stool, plant, light, fan, tube light. 5 things I see around me. So I look at it and notice it and feel like, okay, this is what I have here, this is what I have here. 5 things I see around me, right? After that, you come to 4 things you hear around you. So what do I hear around me? So for example, my dog barking, or the traffic, or someone talking on the phone by the side, or even something on the kitchen, some of your parents cooking, your mom cooking something in the kitchen. bring your senses back to here, right? You're using your senses to bring yourself back to this moment, right? That's 4. Now 3 is 3 things that you can touch. Now 3 things you can touch. You can do this by touch itself now. So for example, feel the fabric of your cloth, right? If it's something, now normally it's winter here, so we're wearing soft clothes. So touch that, feel that texture of that cloth, right? Then if you can see something else of different texture, feel the table, feel your chair. Now these are texture, these you can touch this. You're again using your senses to be back here. Now I feel this chair that I'm sitting on. When your mind is not here, you're not even understanding what you're sitting on or you're feeling on this chair, right? So when I'm feeling this chair, I'm actually experiencing this chair now. My mind is back to this chair, right? It's back here, right? 3 is that. Now 2 is 2 things that you can smell around you. Now smell around you, sometimes you might not have an aroma, so you just smell your shampoo. This is what I tell my clients, right? Smell your hair or smell your perfume, smell your clothes.
Yeah.
You do have a natural aromatic smell of your own body also. So just smell yourself also. That's a smell you can come back to and be like, oh, I smell. Maybe it can be a stink, it can be a good smell, but then it can get your mind to it, to you right now. So smell, 2 smells that you can. 1 is taste. Now taste, for this, easiest thing you can do is have a sip of water, right? Because that's the most accessible thing normally we have around us, right? To taste. Or if you have something else, of course, just look at it all, think about the chocolate now. You have a chocolate in front of you, oh, this must taste so good. Bring yourself back to you. So this is one of the efficient techniques that you can use here. Here you use your senses to bring your mind back to the moment, right? Another technique that you can use is using just your core senses. Yes, go ahead.
Yeah, sorry. So a quick recap, right?
Mm-hmm.
Let's just say I'm stuck in an actual threatful situation or a perceived threat. I don't think,
Right.
I mean, I don't see a snake here, but I'm thinking like, what if snake, comes into my room? That itself creates as much anxiety as a real stimuli did. So, like
Absolutely.
Dr. Vidya said, I'm just revising it for myself, right? Also,
Sure.
people can get benefited. 5 things you can see in your vicinity,
Mm-hmm.
4 things you can hear in your vicinity,
Correct.
3 things you can touch,
Correct.
2 things you can smell, and 1 thing
Yes.
you can taste.
Taste.
Yeah,
Absolutely
perfect,
correct.
perfect.
That's
I'm going to
that's
be
the type.
interrupting you in between to like recap.
No problem at all.
Yeah,
No problem at
yeah,
all. So that is the 5, 4, 3, 2, 1 technique to ground yourself back here. There are various other grounding techniques. So as you mentioned this situation right now, sometimes you're in the threatening situation. For example, you're at home and maybe it's a toxic environment, and some individual is a toxic individual, which is triggering your anxiety, and you feel really anxious or you're scared of that person, whatever it may be, and you can't control this. In such situations, now you need a particular distraction. Maybe you can't avoid this person. At times, that there's no way that we can avoid the situation. If you can keep that distance and step away from that space, would be the first advice that I give you. Step away from that space, go into a space where you're free, where you can breathe and ground yourself to that space if possible. If not, then use your mind to go somewhere else. Similarly, now you can use your mind to use these are mental techniques now. Mental
yeah,
techniques, it could be reciting a nursery rhyme, reciting your favorite song, or you're imagining your favorite place, imagining your favorite person, or we have these comic scenes of movies in our mind, right, which we feel really, really like. Like, for example, I have that Dhol movie, which is that movie where that airplane move bata hai na, like, oh, button mat dabana karke. I think that's a very funny scene. So, we have these typical, and even Hera Fairy ke that, classic ones anyways. So if you have these particular clips in your mind, those funny clips which which make you laugh at all times, right? So go to those spaces and remind yourself and stay there for a while till you can get yourself out of this space, right? So you can use these mental techniques. Other techniques are reciting a table, and reciting a song, or even using visualization to imagine a place that you've been before, like for example a beach or the mountains, a space that you've been before and has got that calm and peaceful environment, and can get your mind to that state. You can use that as a technique. Now other than this, another technique that you can use is breathing technique. So grounding, again, you can use your senses for a lot of things. You can use 5, 4, 3, 2, 1 technique. You can use visualization. You can use cold water, splash cold water on your face. Yes. Another thing that I find essential is in coping with anxiety is concentrating on your breath.
yeah,
Now, there's a biological reason behind it too. right? When we do a particular breathing, there are two types of breathing that are very essential and helpful in during an anxiety attack or when you feel anxious is diaphragmatic breathing and box breathing. Now, in both these breathings, what happens is your diaphragm, there's a muscle for your chest, right, which has a nerve supply. Now, when it is inflated a lot, like maximum inflation, what happens is that nerve gets stimulated, and this nerve stimulates your parasympathetic nervous system. That is the nervous system responsible to relax your body. This is the biology behind it, so that people understand, what is the reason you need to actually take deep breaths, right? Because a lot of people don't understand the reason behind
Yeah.
deep breaths. It's like, what is deep breaths going to do? Deep breaths, not doing anything. So when you take deep breaths, that muscle expands to the maximum. And when it expands to the maximum, it stimulates that nervous system, your parasympathetic nervous system, and it automatically relaxes you. It sends a signal to your brain that, okay, that response needs to be elicited now. This is like kind of like your opposite of the system which is stimulated when you get stressed or when you feel anxious, right? I'm sorry I lost you,
Which
Dr.
is,
Charan. Hello.
can you hear
Is it
me?
my network? Yeah, I lost you there for a second.
Okay. Yeah, yeah.
Yes.
The
Yeah.
one which is responsible for anxiety is sympathetic nervous system.
Correct.
What we're
Exactly.
trying to do
So,
is stimulating parasympathetic nervous system.
which is the opposite, which does the opposite of what the sympathetic does, right? So it cancels that response and it relax your body. So that's why
Yeah.
breathing technique is very, very essential here because it automatically relaxes you by stimulating that nervous system. And the two as I said, is diaphragmatic and box breathing. Hello there, lost you again. I'm not sure if is it my network. Should I check on mine? One second.
Um.
Audience, can you please tell us if it's my network or Dr. Charan's network?
Can you see me now? Can you hear me? Am I
Yes, yes,
moving?
yes, 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 yes. You're back.
Yeah.
Yes,
Yeah.
I can see you now. Daily problems these are now. Internet issues. Right? So this breathing technique, as I mentioned, is one of the essential ones that I think is very useful to do. And anytime, as you mentioned in the start of this, not only if you have an anxiety disorder, even when I feel anxious, I kind of take a few breaths, release this tension from your body, just release it. Now here I do something else is an affirmation. Okay. So this is I
Um.
go ahead.
Sorry. So how do we do? Okay. Someone said my network is somewhat poor.
No,
Can you tell me
it's good now. It's good.
it's better now? Yeah. Yeah.
It's good.
Yeah.
It's good. Yes.
Yeah. So how do we do box technique of breathing? I do it
Right.
usually, but yeah, how do we do it for
Right.
people who want to
So
do it?
box technique is now when you inhale. So box. So imagine a box.
Yeah.
All right. So it's 4 seconds inhale, 4 seconds hold, 4 seconds exhale, 4 seconds hold. That's why it's a box breathing. It's called box breathing. So it's a 4 second, remember 4 second rule and count it. Now, another thing on this breathing, which you should bring your mind to is get yourself to mentally count it because again, you're bringing your mind to your fingers or the number in your mind. Right? So it's like, okay, 1, 2, 3, 4. So now you're mentally counting it. So your mind is again being concentrating on this rather than something else in your mind. It's bringing that attention to that count. So that also helps a lot. It's kind of like a grounding way of bringing your attention back here.
So it is
Right?
a slow and deep breathing, right?
Yes, absolutely. Slow and deep breathing. And diaphragmatic breathing is you take in for 4, hold for 4, and exhale for 8. So it's a different breathing. So inhale, only thing is you make sure in a diaphragmatic breathing that is your tummy, your stomach, is filled up, overly extended more than your chest. Right? So normally what you do is just take 2 hands and keep one on your chest, keep one on your stomach. And when you inhale, make sure that stomach is rising more than your chest. So the most, how much ever you can take it, like inhale as much as you can, and making sure your diaphragm, that is the chest muscle, is expanded maximum, and then hold for 4 so that it sends the nervous response by then, and then release it. And in that release, then response is also elicited. Yes, so
Some
that is the
people,
technique.
yeah. So some people, when we ask them to take deep breaths, they do hurried breathing that will cause hyperventilation and worsen anxiety. So
Absolutely.
yeah.
Absolutely. Yes. It is always take your time. That's why do the count, do slow breathing. Don't be hasty in it. Because the reason being is because, when you feel anxious, people want it to go away immediately. It's like, I don't
Yeah.
like this feeling. I want it to go away immediately.
Yeah.
So this
Yeah.
is something I want everyone to understand is, don't focus on making it go away fast. That makes you even more anxious when you try to do that. And when you try to be like, I need to do something about this, like why isn't this going or something, it makes you even more anxious. Instead of focusing on that, this is again another strategy that I use is that just call out the anxiety and be like, you know what? I understand now. I'm feeling anxious. This is my anxiety. I need to breathe through this. Someone has something to say. I missed something. Oops.
If anybody doesn't think that a certain technique works,
Vandana,
my
you don't agree with the breathing technique or do you agree? I do know, Vandana. Hi, Vandana. Hi, Vandana.
okay. So if someone thinks that they don't agree with something, just know that find your technique, what works for you. For example,
Absolutely.
I have tried 3 4 and they didn't work at all. So what worked for me was something else. So find out what works for you in this.
Oh, Vandana says in yoga, you need to do exhale more deeply first. Oh, yes, of course, in diaphragmatic, it's for 8 seconds. So you inhale for 4 and you exhale for 8 seconds. So it is more. Absolutely.
Yes. Yeah. I think she is with us on that. Yeah.
Yes, yes, yes. Right. So, and again, something again Vandana had told me, that reminds me what she had taught me is that, your breath unites your mind and body together.
Mm.
And that's very essential. When you breathe, it's you, and you concentrate on your breath, it does unite you together, right? So,
Yeah.
yes, absolutely, it's important there, right? What I was discussing before that is calling out the anxiety. Yes, that, be sure that you understand that, yes, this is making me anxious. I understand that the moment you accept it, it makes it easier for us to, overcome it and do something about it. But when you try to make it go away fast, it's not going to go away. It's a
No.
response in your body. It's not going to go away immediately. It's going to take a few seconds or a few moments to go away. So just allow yourself to accept that and work on it with your breathing or whatever works with you, whatever breathing works for you, whatever technique works for you. And something I do is an affirmation, as I said. Now, an
Sorry.
affirmation, no
Sorry.
problem. Go ahead.
Also before that, like, don't be so stressed about getting the 4 and 8 and
Yeah,
this and that right,
yeah,
because it's a genuine practical problem. Some people keep asking me, you said 4 and 8, right? Not 8 and 4, right? When I tell them, you know, this technique works better, but even there are different kinds of breathing techniques that work. Just take slow, deep breaths, whichever it may be. First of
correct,
all, move out
correct.
of the room. For example, let's just say
Yes.
I'm in a boardroom meeting or I'm about to go to the boardroom meeting. Go to a washroom. Go lock yourself. Find a quiet place. Maybe not so
Absolutely.
claustrophobic, but some little open space.
Open
Um,
space.
just take slow, deep breaths. You know, don't be so stuck up on 4 and 8. But if you can, 4 and 8 works really well. These are proven
Absolutely.
techniques. Yeah.
Yes,
Sorry. Go to
absolutely.
affirmations. Yeah. I already stopped
Yes,
you.
no issues at all, no problem
Yeah.
at all. Yes. So the reason affirmation helps is because it gives you a sense of safety, right? When I tell myself now, if I'm feeling unsafe, if I'm feeling insecure, if I'm feeling like I can't do this, and that's the fear that I have, right? That I'm going to mess it up or I'm going to fail at something. And if I tell myself stop and call out this fear that it is a fear of failure, because anxiety is a response to a fear that we've had.
Yeah.
Normally it is that, and that's why a fear we've inculcated or been conditioned to for a very long time, experienced through, right? So to deal with this fear, of course there's a lot more. There's therapy and medicines and a lot of things to deal with it, but at that moment, temporarily, you can just be like, you know what, I'm safe, secure, I can deal with this, I'm going to get through this, I know I can, or what I do is I'm awesome, I'm amazing. I do really, really different things, what I need to hear at that moment, right?
Yeah.
For yourself to calm down. The moment you do that, you tell yourself, I am safe and secure and everything's going to be okay, I can deal with this. And you start believing that, your mind is like, okay, I'm safe, I'm secure, I can do this. And that response comes, then, tends to calm down because now your mind thinks that. And for that moment, it helps you overcome that situation, right? And affirmation is not a treatment, but it absolutely helps in that moment. It's a kind of
Um,
strategy. Yeah.
but subconsciously, we all do affirmations. Like, people don't know that it's called affirmation. Um, you know, people wait for someone else to tell you that, hey, you got this, you are awesome.
Correct.
Don't wait for someone else to tell, you know,
Correct.
that is very transitory. That doesn't last long unless, you know, you have someone else to keep telling you all the time. Tell yourself, you know, my
Absolutely.
affirmations are, you got this. That's my affirmation. You
Yes.
got this. I
Who
might
got
win
this?
it, lose it, doesn't matter. I got this. I can deal
So
with it.
I'm sorry.
Uh,
I'm going to correct you. You need to do this as I got this rather than you got this.
Yeah, yeah. So I
Yeah.
tell myself
Right.
that I got
Yeah.
this. No, like
Yeah.
I tell myself like you
Yeah.
got this, as in like
Right.
me.
Yes.
Me the second person I'm speaking to myself.
Yeah.
Um,
Exactly.
yeah. So I tell like, you know, hey Sharon, you got this. So I also tell it's not the end of the world. It's not the end of the road. You know, you'll be fine.
Absolutely. Yes,
Yeah,
absolutely. And these small little talks with yourself is essential, very
yeah,
essential, because something we all overlook is, I think, our relationship with ourselves.
yeah,
And foundation of any relationship, I think, is communication, right? Any relationship you look at, it's
yeah,
based on how you communicate with each other. And if your communication with yourself is negative, your relationship with yourself is going to be very weak and shaky, right? So try to keep it as empathetic, compassionate, as understanding as possible, right? Understanding what you're going through and telling yourself what you need to hear. And that makes you independent in a way, because as you rightly mentioned, when we look outside for someone to tell you that, sometimes you might not have that, and what will you do then? So if you have yourself to tell yourself, yes, you got this, yes, you can do this, that feels good, right? And it's okay to do that for yourself, right? So absolutely, affirmation helps. Something you mentioned about subconsciously that we need to do about it, right? So, subconsciously, there is a conflict at times
yeah,
when we tell ourselves this, that I can do this. And subconsciously, my mind's like, no, no, you haven't done this for a very long time. How can you do this and all of this? Absolutely. There are conflicts at times. And sometimes people, and a lot of my clients tell me this, I don't feel it when I say this to myself, right? I don't feel that way when I tell myself I'm worthy or I'm enough or any of these things, right? And when that happens, there is a conflict in your subconscious, and it's okay. I understand. You can work at it with the help of a professional. I mean, therapy helps wonderfully here, but you can also do it with a writing exercise. So
yeah,
something you can work with yourself later, not when you feel anxious, but if you want to work on your thought process, because that's where your emotions and behavior stem from, right? Your thoughts, your beliefs, right? So just write down these negative thoughts that you have in like one pattern. I believe Dr. Charan had also made this post. I saw that recently. Right? It's a similar thing, right? Just write them down, and then the right side column should be the positive of it. So it will be like, what will happen if I fail? The positive, like, what will happen if I pass? Like, just convert it into it and try to do that as a pattern. Memory problem. If someone has a suggestion for your
no, we'll take,
next
I'm
session.
sorry guys, we'll take questions a little later because you keep posting, you know, I'm going to read them in the end of this thing. Yeah.
Absolutely, absolutely.
Also,
Yes.
before you continue this writing and expressing yourself, you beautifully said the most important relationship is with yourself, which is often
Absolutely.
neglected. I think the most
Yes.
toxic and abusive relationship is with your own self because we all communicate to us.
Absolutely.
Yeah, we all communicate to us only when we are critical, self-critical.
Correct.
You know, we always criticize ourselves.
Correct.
We're like, hey, what the hell? What the hell are you doing? You know, only negative things. You never give credit to your positive side. You know, you don't have to talk like they show in
Right.
movies. You don't have to go in front of mirror and do it. You can just sit and talk to yourself like, you know,
Absolutely.
hey, but you are a kind person. You are a good person. You know,
Absolutely. Yes.
that is very important. Yeah.
So, and that's the thing, right? We somehow learn behaviors
Yeah.
from how we've been treated.
Yeah.
And we tend to treat ourselves the same way, but we don't realize it,
Yeah.
right? This is what I say. I mean, I think I put a post recently, today only, I think, about, notice how you treat yourself. If you are treating yourself how others treat you, how are you any different from them, right? How are you treating yourself any different? So treat yourself the way you deserve to be treated.
Yeah.
Yes, with your love and
Also,
yes.
I feel if you treat yourself well,
Mhm.
others will treat you well. You know, it's a cause and an
Absolutely.
effect. Yeah.
Yes. Correct. Correct. Because if you treat yourself well, you know how you need to be treated and you won't allow anything else towards
Yeah.
yourself,
Yeah.
right?
Yeah.
If you treat yourself badly, then you'll be like, okay, that self is like, okay, I mean, this is okay because I also believe that about
Yeah.
me. And if
Yeah.
anyone else treats me that way, it will be allowed. But if
Yeah.
you don't, and if you know how you need to be treated and how you should be treated, you wouldn't allow that even to happen to you.
Yeah.
Yes.
Yeah.
That's, yes, we've strayed away a little bit from the topic, but yes, it's essential. It is very, very essential that your relationship with yourself and
Yeah.
in overcoming anxiety as well, right? So, overcoming anxiety is not a one-day thing, it's a journey, right? It's a process that you're going to go through. And during this time, if you are empathetic, compassionate, and more kinder to yourself, you can overcome it more, not, and I'm not saying easily, but more beautifully. You know,
Yeah.
you will be able to overcome it with more grace and be able to overcome it well. But if you treat yourself with harsh words and judgment and criticism, it's going to be difficult for you. And who's making it difficult for you is you,
Yeah.
right? So understanding how you're treating yourself is very important, because if you treat yourself, compassionately, you can easily, when you fall down and when you're in a space where you don't know what to do, you can tell yourself, you know what, it's okay if you're feeling this way. I can get up and try again tomorrow, and that's going to keep you going and help you overcome this journey. Yes,
Yeah.
right.
Because most of the time our anxieties are far more scarier than reality. Reality is often not that
Absolutely.
bad. Yeah.
Absolutely, they are. I mean, they're very, very deep rooted, and they are fears that have become stronger with time. It's not. I mean, from what I've seen, most of the anxiety disorders are from. I mean, they're very strange, but psychological causes is most of them are from very deep rooted fears, right? And from very traumatic experiences or experiences which have, affected them very strongly. And in your mind, it is a very strong space,
Yeah.
and it's much more scarier than reality, as you mentioned, right? Symptoms of anxiety, Harshit, you can check on mine, or I think Dr. Charan, I'm not sure if you posted, but the signs and symptoms will be discussed there. Today we're talking about coping strategies with anxiety,
I'm
right?
Here, Harshit. I'm definitely gonna get back to you. I mean, I'm definitely gonna do a talk about social anxiety, panic disorder.
Absolutely.
Just watch out this space. But if you quickly want to know, there are physical symptoms, psychological symptoms. Physical are
Correct.
racing heartbeat, not able to breathe, feeling lightheaded, giddy, blurred vision, urinary urgency. Psychological symptoms, and there's some many more.
Hmm.
Psychological symptoms of feeling restless, feeling of doom, feeling of loss of
Correct.
control, excessive
Correct.
fearfulness, excessive worry about self and others, which most
Correct.
of us have experienced in the times of pandemic, which will be taken care if you follow the techniques that Dr. Vidya is discussing. Yeah, sorry. Yeah,
Correct. Not an issue.
yeah.
Yes. Now, something in the long run of overcoming anxiety that helps is movement.
Mm,
Now, how movement helps is because anxiety is a form of restless energy now, right? Even if you've tried to ground yourself and try to overcome this from this space and understood and dealt with the situation, somewhere that restless energy is stored in your body.
mm,
Because as I told you, anxiety is a response to a dangerous situation. And in that situation, your mind thinks that you need to do something right now, right? Then action is expected from your mind. But if you don't do that, now that energy is stored somewhere in your mind. Imagine that to be an energy which is stored somewhere in your body or anywhere. Because that action is not taken, you're just maybe in that space. You were not able to move because you froze maybe, and you weren't able to do anything. So to be able to release that energy somewhere, movement always helps. And every individual who has been suffering from an anxiety disorder has had much, much beneficial results when they incorporated the treatment with the physical activity, any kind of physical activity. So it can be dancing, it can be exercise, yoga, or just freestyle movement of your body, right? It need not be something which is planned and organized, or a civil form of thing, cultivated form of movement. Yes, it need not be. It can be a very free movement, right? Just put on the music and allow your body to go the way it goes, or just go for a walk, go for a run, whatever you can use your body with, and how you can express it through your body, release that energy from that body, right? Otherwise it stores inside of your body, and even when you're not anxious or not understanding anything, you see it as shaking your legs and biting your nails, right? It shows in your body otherwise, right? So release it somewhere, and absolutely helps otherwise, because when you do physical activity, there are toxins released from your body again, right? So there's toxic release, and there is an adrenaline rush, there is a dopamine rush, a sense of accomplishment that you get once you do that activity on a daily basis for yourself, and that all balances that stressful space that you had and makes you feel much more better about yourself, which again strengthens your relationship with yourself and helps you in that journey to overcome. So movement, I think, is very, very helpful in the treatment of anxiety and, helping you cope in the long run. Yes.
Yeah, I agree with you because, in anxiety, there is one more important symptom I forgot to mention was muscle tension. So I was
Correct.
feeling so
Correct.
stiff and rigid and
Correct.
everything.
Same.
Recently,
Exactly.
yeah, last year I went for some art class, and the next room they were teaching dance therapy. So I thought it's a dance class, they're teaching some dance, but
Mm.
they were not coordinated at all. They were just allowed to
Correct.
just do the way they
Correct.
want. If you think you will look ridiculous, I mean, if you are a person who is so conscious about your image, you go find a room and just do it by yourself. You know?
Correct.
Yeah.
Just lock your room and put on your music and do anything that you want. And that's the reason, that muscle tension is because it's the biological response. We need to be able to
Yeah.
do something. So muscle gets tense to do that action. But now when that expectation of your body is not met, now what happens that tension stays. It's
Yeah.
not released. But when you allow your body to move, that tension is released, right? So it helps you that way, right? So that helps really in the long run as well. Yep. So grounding, breathing, movement. Then there is affirmations, calling out your anxiety, right? These are few things that you can really, really use to help you overcome anxiety. At the same time, sitting with your thoughts and trying to reframe those thoughts at a conscious level,
Yeah.
challenging these thoughts, right? Challenging your thoughts help at a conscious level, not all the time. In the sense, when you're feeling anxious, it might be difficult to challenge that thought right now. So use grounding and breathing that time to help yourself get to a calmer state first, then get to that challenging of thoughts state where you're able to do that. Don't overload yourself with anything more. When you're already overloaded in your mind, just stick to one of the techniques which helps most with you, right? So try out whichever is most comfortable for you, because for everyone it works differently,
Yeah.
right? And even grounding techniques, I've just mentioned a few grounding techniques here, and as I said, there are various ways people can do that. One of them is just lying flat on the ground as well.
Yeah.
Just like go lie flat on the ground, and this again has biology in it, because your postural uh, changes which happens when you go from here to here. There's a postural change which happens in your body. Your nervous system again relaxes you immediately. You know how you get into bed and you feel relaxed, then
Yeah.
immediately your whole body language changes. There's an immediate relaxation space that you reach in. So exactly, so go lie flat on the ground and you will be in a relaxed state, right? So that also can be used as a grounding technique for yourself.
Yeah.
Yes.
So these are a lot of positive coping strategies. All of us cope. We all have coping strategies, but most of us cope in a
Unhealthy.
self-destructive and
Correct.
negative pathway. We either
Correct.
when I tell IT, I get a lot of IT patients. When I tell them, why don't you do some deep breaths? When you're
Mm,
anxious, let's say you have a board meeting, you're anxious.
mm, mm,
Instead, the person tells me instead of that, what he or she was doing was they were going into a quiet place and they were smoking.
mm. Right. Yeah, a lot of people do that.
A lot
Yes,
of people do that.
absolutely.
Or some people have drink, have
Mm,
alcohol. Um, you
right.
know, some people, turn the anxiety into anger and they show it on other people. Like
Correct. To project it.
they displace the
Yes.
anger from the boss to somebody who is working like under them, like a grade below.
Under them. Yes, absolutely. Yes.
Yeah, I mean, these are negative coping
Yes, there are a
strategies.
lot of unhealthy techniques. So the thing is,
Yeah,
not a lot of people are aware about it. I mean, the only way you can understand on working this, the first step is awareness,
yeah,
right? Suppose if you do have bad relationships, if you feel like your relationships are going awry, if you feel like you have a dependency on substance or anything, an unhealthy dependency, which is somewhere affecting your mental health or physical health or even your life per se, you need to first start looking at it. That is, what is the reason that I'm still dependent on it, or uh, how do I how did it start? Because most of the times, this is again one of the reasons I actually got into psychology is, most of the times, when we look at diseases, like for example lung cancer or BP or anything, like there's a lot of predisposing factors like alcoholism or
mm,
smoking and all of these things, but no one goes to the root causes of what is the reason someone started smoking, what
mm,
is the reason someone started drinking alcohol and being dependent on it, right?
yeah,
There is a cause there. There is a dependency, a pattern that led to it. There is something in the person's state of mind that led to that dependency. It has to do with it, right? So that awareness again, it needs to come internally. to understand that I need to change this pattern and choose a healthier one, right? And it requires a lot of introspection.
Yeah.
And one of the ways you can understand your thoughts, a lot of people like, I don't know how to do it. I understand we're not taught how to do that, to introspect and look at ourselves from a different pair of eyes. Maybe just start by listening to your thoughts, writing
Yeah.
down your thoughts, getting clarity of your thoughts. So when you're feeling stressed or when you're feeling highly emotional and you don't know what it is, just write them down, because normally our thoughts are in like a jargon in our head, it's like
Yeah.
it's all like a barn of wool. We don't know how to connect it because it's all so much. It's all mixed. People say, I feel mixed. I don't know how I feel. It's a mixed emotions.
Yeah.
So how do you get clarity? Write them down. Write it all down as it comes. Don't be judgmental. Like, this is again, we feel like I shouldn't feel this way. Why am I feeling this way? It's okay what you feel. Just write down all of them and then look at it and be like,
Yeah.
okay, nah, and you'll get some understanding of yourself there. And then, you can somewhere introspect and understand. And even if you don't, then go get professional help. That's okay too,
Yeah,
right?
yeah. Because sometimes not all anxieties are bad, you know. Moderate anxiety is what
Absolutely,
keeps us
yeah.
going. That's thriving. You
Absolutely,
know,
absolutely.
I remember my HOD used to tell me when I was presenting like a paper or a seminar or something. He used to tell me that something is wrong with Charan. He's never anxious. He just comes and he just speaks so confident. He always told me having too little of anxiety is also not healthy.
I
It,
agree. I agree.
it's
I
good
agree.
to
But then
have. It's
absolutely, you need that. It's a protective mechanism in our body.
yeah,
It's how it's
yeah,
programmed. But again,
yeah,
disorder is different. Yes,
yeah,
and a lot of people function very well in anxiety. There's high functioning anxiety. Yes, so
yeah,
that's a thing. A lot of people do function very very well in anxiety, because it's somehow because your nervous system is at peak. Your brain is at its peak when you're anxious. But at the
yeah,
same time, each person has different mechanisms and responses to a situation. So we
yeah,
cannot compare
yeah,
anyone's anxiety to anyone here.
yeah.
Yes.
So I think we covered pretty much a lot of important techniques, right?
Yes,
Some
absolutely.
anonymous techniques which like that work for me, I would like to share so someone
Mhm.
can relate to that,
Absolutely.
right? I doodle. I started doodling, not
Absolutely.
excessively,
Yes.
but a little bit, like once in a while. It just distracts me very in a very smooth and organic manner without having to uh, face my anxieties too much because I don't think so. Those
Absolutely.
are important anxieties. They're very like silly insecurities that I have, and I go for a drive that
Right.
distracts my brain. I make a meal, so I
Mm-hmm.
focus completely
Mm-hmm.
on the ingredients. I think probably I'm also
Absolutely.
grounding there, right? I'm touching,
Correct.
smelling.
Correct. Absolutely. Yes.
Yeah, yeah.
That's
So
grounding.
I make a salad, or sometimes I bake. I indulge myself into some
Awesome. Yeah.
guilty pleasure
Lovely.
of
Yeah.
eating a
Yeah. It's all
chocolate
it's
cake.
all good technique, healthy techniques to bring yourself
Yeah,
to the moment.
yeah,
Something about doodling, this is something I actually advise my clients to do.
mm,
Doodling, the
yeah,
reason being, when you doodle, you're letting your hand free. You're not
yeah,
consciously doing it, right?
yeah,
So what's happening here is you're releasing your subconscious emotions and energy here,
yeah,
even though you don't understand. So this is something when a lot of people tell me that I don't know how to put my emotions down, I don't know how to put it in words. I'm like, don't use words. Just let your hand free. Whatever you feel, if it's anger or a lot of mixed emotions, just let it out on a piece of paper, however it comes.
yeah,
Right? Even if it's anger, it'll be like, even if the paper tears, it's okay. I'm just like, let it out. At least there's an outlet there. And yes, that energy is released there. So absolutely doodling helps. And there's a thing called graphotherapy also,
mm,
which is again along the same line but a little
right,
different. But again, yes, by writing, right? But doodling is again free. So
yeah,
we don't understand what it is that's coming out here. That's the only thing that we don't know, because as you said, for little anxiety we can use it. But it really, really does help. At times when you don't know what to do, or
yeah,
when you want to move it somewhere, just like let it out through your hand somewhere on a piece of paper. Yes, absolutely helps. And
yeah,
yes, cooking and uh, you know, uh, just sketching or even drawing and coloring books. Coloring books are very therapeutic.
oh
I
yeah,
mean, I
yeah,
think is coloring books. Also, one more aspect of a coloring book is it helps you connect to your inner child, which makes you feel always like in a very happy space, right? So that's very helpful. And I would always advise people to practice meditation
yeah,
as a part of your day. Now, when you start practicing meditation by yourself, it can be a little difficult. People still,
yeah,
a lot of people tell me, I might get wandering thoughts. I don't know what to do with it or something. So maybe go to a class, get guided meditations, when you start read about it, research about it before you start. Just don't start just like that, because when you meditate, there are going to be thoughts coming up. There's going to be, thought process. There's going to be a lot of things that coming up, because that's how we are trained, right? We very hardly know how to stay in this moment. Our mind is always somewhere else. Our
We're
mind
always,
has been conditioned.
yeah,
Yeah.
we are in time for restlessness all the time.
Absolutely right. We've been conditioned that way. And meditation helps us to train our mind to come back to the present and stay calm. Right? But in the beginning, it's not going to be so easy because,
Yeah,
as I said, we've been conditioned that way. Right? So in the beginning, if you're a beginner, always get help. Do your research, get a teacher, get guided meditations, use help for it. Don't start off just by yourself. I would always advise you that. Right?
yeah,
Because a lot of people tell me I meditate and I find it even more difficult. I'm like, no, get help for it.
yeah.
Use a proper technique and understand it properly, and then do it, because everything has its own nuances and reasons and techniques behind it, so you need to understand those as well.
Yeah, some people tell me, Doctor, meditation is so boring. Can I do something else? Then I tell them, this
Right.
restlessness is what got you here. Sometimes
Exactly.
you're supposed to calm down. Going to gym and lifting weights when you're anxious not going to help. It's going to further increase your heart rate, and like it's
Correct.
not going to be
Correct.
good for your heart. Meanwhile,
Correct.
you're supposed to
Correct.
calm down. Anxiety is a hyper
Correct.
situation. You're supposed to
Correct.
go mellow.
Slow
Yeah,
it down. It's okay to
slow it
slow
down.
down at times. We're
Yeah,
always running after something, no, in life. That's the
which we
reason when
don't
we
know.
slow.
We don't even know
Yeah.
what we're running after.
Exactly, we don't know. It's how sadly our society has conditioned us somewhere in the system that we've been, that we
Yeah.
run after things in our life, and that's why when we slow down, we feel uncomfortable. Like, what is the point that we sitting down and That's why people say it's so boring. I don't know what to do by just sitting by myself. I'm like, it's okay to just sit and concentrate on your breath, and just be there for a moment. It's okay to slow down at times. And I think, I mean, ironically, that's how what 2020 has somewhere told us as well, that it's okay to slow down
That's
at times.
my, I mean, I understand pandemic and the people dying and everything is awful, but there is also a good side to this pandemic.
Absolutely, I
I'm
agree.
always looking at the good side of this. It has
Same
done
here.
so much good than bad, I feel. Yeah.
Absolutely, I agree. I agree. I agree on that. I think also a lot of people have, even though it's forceful, a lot of people have had time to sit and think about themselves. And I'm sorry about my puppy.
Mm.
Uh, yeah, to think about themselves and sit with their thoughts and understand their thoughts, and understand that I need to look into it, and this whole awareness about mental health and the increase of it and people taking action on it is something I look at as a very positive sign, even though it's come from dire circumstances and a forced circumstance. It's because they've not letting me in these
No,
thoughts
I think
properly.
your puppy wants you back.
Yeah, yes, yes. He's waiting for me to come out.
Yeah,
Anyways, yes,
I won't keep you long. I won't keep you long. Before you go, Dr. Vidya, one quick tip about muscle relaxation. JPMR, how do you do it
absolutely.
briefly?
Briefly, so how we can go about it is just first close your eyes, concentrate on your breath. Okay, just start by coming back to you, acknowledging your body, right? So close your eyes, come back to your breath, and now you can start with one region. You can start with one region of your body. So choose maybe your leg, okay, and then tense your muscles in your calf muscles, for example. Tense it now. Just feel that tension in your body, and then release it. Right now, what's happening is this relaxation sends signals to your mind again, and also the tension as well. Now, when your muscles are too tense, also it sends a negative feedback to
Yeah.
your brain saying, you need to relax now. It's too tense. It needs to relax. Right. So start with one region at a time. Something you can do is put on some calm music. So this is what I've tried. Put on some calm music in the background to mask anything else which might come in your mind. You can use it as a masking thing, and bring your attention to your body. So start with the region. Start with from down to bottom and bottom to top. So start with the legs, then come to your thighs, then come focusing on your thighs, clench it again, and then release it. Again, now come to your hips and thighs, clench it again, and release it. Now, what you're doing here is slowly and steadily, each area of your body is getting your attention. At the same time, you're releasing that tension from that body. Even if you might not have been aware of it before, now you're aware of it. And you're getting your awareness to your body and releasing that, relaxing each and every part of you. And this progressive tension and relaxation also somewhere taps into your subconscious. Now, a lot of people when they go through this have had emotional experiences where they've somewhere touched upon some emotion, something might come up. Now if that happens, let it come,
Yeah.
just let it flow,
Yeah.
right? It's something which has been waiting to be addressed and which you've been holding on to. And when you're releasing, right, we don't understand because subconsciously maybe that emotion is trying to be released as well. And
Yeah.
now that the muscle consciously you're releasing it, you're
Yeah.
doing this activity consciously. So somewhere you're letting out a space to let go of that tension that you've collected in your body. And we do collect a lot of emotions and energies in our body as well. So if an emotional experience happens, just let it go. It's okay. If you feel like crying, let it out.
Yeah.
Yes, it's absolutely okay to let it out at that moment. Maybe sometimes you might understand, sometimes you might not understand. It's okay. Just understand that, there is something that needed to be addressed
Yeah.
and needed to be let out. And that's the reason it came out here. And it will help. You'll feel much lighter by the end of it.
Yeah.
Yes.
That sounds great. Thank you so much. This has
My
been wonderful.
pleasure.
This has been
It
wonderful.
was been absolutely wonderful. It was lovely to do this live with you and actually talking with you and having a conversation with you. I think we should have a conversation off the live as well and
Oh
discuss a
yeah,
few things.
100%, 100%. Most of my friends are Malayalis. In
Oh,
fact,
is
all my
it?
friends are Malay. I'm assuming you're one too, right?
Yes, yes, I am. I am.
Yeah. Like
Absolutely.
my best of my friends are Nayars as well. Like when that was stuck. Stuck. I noticed me on your profile. I'm like, oh,
Yes.
yeah.
Nice.
I always feel like that when I see a Malayali. I feel I'm more a Malayali than a Telugite. Even though I'm born and
So
brought up in Hyderabad.
maybe you had some cosmic connections back in the days with the Malayalis. That's why we're all
I studied in
coming.
Mangalore. Mangalore is part of
Uh,
Karnataka, but then
yes,
it's all
yes.
Kerala. It's coastal,
It is
and
all Kerala. Yes,
yeah, I,
absolutely.
I was there for 11 years, so I have deep roots of, I love Kerala food. I keep
Uh-huh.
searching for,
I miss
Kerala food in Hyderabad. So people ask me, "Oh, doctor, I didn't know you're a Malayali." I'm like, "No, I enjoy Kerala food
Oh,
quite
you
a bit."
missed it. Yes, Kerala food is amazing, and
Oh, it's
especially seafood.
fantastic.
It
All
is.
I like is like if I don't get Kerala food, I keep looking for Thai food, which is similar to Kerala food again.
Yes, absolutely. But the
Yeah,
spices, I think, is what makes it so
yeah,
amazing, right? It's
yeah,
just
yeah.
too good, too good.
Fabulous,
Yes.
and also healthy. Yeah, yeah,
Yes, absolutely. Yes, very healthy. I mean, you can always opt for it over anything else.
yeah.
Yes. All
Well,
right.
thank you. That is a
I hope.
wonderful talk.
Yes, it was absolutely wonderful. I hope I've covered quite as
Yeah,
much, and I hope
no,
some people
no.
have got some good information about how to deal with things.
Yeah,
Thank you, Dr. Charan, for having me here. It
thank you,
was a
Dr. Vidya. Pleasure
pleasure.
is mine.
Yes, I hope you have a lovely evening
You
and
too.
take care
You
of
too.
your health. Yes, take
Yes,
care
go
of
back to
yourself.
your puppy. I think your puppy doesn't like me too much. I kept you long.
You see, like you've been there for too long now. It's been more than that.
Yeah, yeah.
Yes, absolutely. All right, take
All
care.
right. Bye.
Bye.
Take care of yourself. Good night. Bye.
Too. Good night.
Yes, that's Dr. Vidya for us and her profile. Please go and check out. It's Dr. Goodvibes, and she's all about that. This talk is supposed to be on Wednesday, but because of my personal work, I have pushed it to Monday. But from next week, as usual, we'll have our Wednesday talks. So stay tuned. Drop in next week. Or I hope all of you are staying safe and taking care. Finally, 2020 is going to end, but the pandemic isn't. So I, as a doctor and a responsible citizen, I request all of you to please be careful in maintaining your social distancing and everything. Don't be under false impression that vaccine is already out and it's going to come in a month and we're going to be fine. Even after vaccine comes, there are booster doses. It takes some time for the antibodies to develop. Um, so you know what? This is not in our control. The one of the important things about anxiety management is letting go of the things that are not in your control. So I divide everything in life into: can I control this? Can I not control this? Can I change this? Can I not change this? I only care about things that I can change, and the rest of the things I try to let go. That's what is keeping me mentally healthy and happy. I hope that works for you all too. You all have a good evening and a safe, few days or months ahead. Bye.